All right, I just finished washing my hands. My name is Joshua Geiger. I'm a family nurse practitioner student from Saginaw Valley State University. I'm going to be performing my peripheral vascular as well as my hair, skin, nail assessment on Lindsay, who we have here. A couple general health questions for Lindsay regarding the systems we're going to assess. Do you have any family history of skin issues like skin cancer, cysts, boils, blemishes of any sort?
No, not really family. My dad has a lot of freckles and I have a lot of moles, but I regularly get skin assessments done to keep an eye on those.
Okay. I'll kind of get ahead of myself here. Any moles or macular areas that I would find on Lindsay, I'll assess for any abnormal coloring, any irregular borders. Ask her if they are increasing in size or color, shape, any evolution. And then if they're increasing in like diameter or anything like that as well, or if they're asymmetric. It's kind of going back to a little more of the health history before we start your actual assessment. Do you tan outside at all?
Sometimes, but not very often.
Okay, and you wear sunscreen when you are outside?
Yes.
Okay. Do you ever like tan inside, tanning bed, anything like that?
Not really. I have a couple times in my life, but it's not something I do commonly.
Okay. All right, now I'm gonna begin with the hair assessment. I'm gonna part her hair in several locations, just looking to see if there's any lesions, if there's any scarring, any cuts, anything like that. And then I'm gonna be noting the consistency, texture of her hair. It seems like she's got a pretty full head of hair. Looks like kind of down the middle of her part, she does have a slight sunburn from being outside, which is normal finding in women. So then what I'm gonna do is I'm gonna kind of step around to the front of her. And I'm going to look at her face, I'm going to look at her eyes, I'm going to take a look at her ears, inspect her ears. Women, probably not as much because they have hair covering them, but on that could be a spot of sunburn, potentially abnormal skin findings. And while I'm assessing her face, inspecting her face, I'm going to be looking for any discoloration, any erythema, any jaundice, cyanosis, any pallor. I'm looking at her sclera. Sclera are white, her conjunctiva, it's going to fold them down, are pink, pink. And then I'll have her open her mouth, say I see her tongue, her soft palate, hard palate, her gums, just seeing if there's any discoloration, which there is not. Now take a quick look at your fingernails, look at the fingernail bed, see if there's any discoloration. While I'm down at the fingernails, I'm just going to assess for cap refill as well. A nice brisk cap refill, less than 3 seconds. And it looks like she takes pretty good care of her nails. I'm not seeing any hangnails or anything. There's no clubbing, no paronychia, anything that would indicate any sort of infection. Okay, now while we're at her arms, and then kind of goes for her whole body too, as I'm assessing arms, legs, trunk, face, I'd be looking for any sort of lesions. As she mentioned, she has freckles, so kind of like macular rash. And then looking for any areas of hypo or hyperpigmentation. So first off, looking at her arms, each arm, looking for symmetry, looking to see if there's any swelling, any discoloration. And of course, I already looked at her nails. So I'm going to use the backs of my hands, and I'm just going to palpate down each arm, noting the temperature, noting if there's any moisture, which her arms are pink, warm, and dry, which are normal findings. And while I'm here as well, I'm going to palpate her pulses. I'm going to start with the radial pulses. I would say those are approximately 2+ bilaterally. Now the brachial pulses. And those would be 2+ bilaterally as well. So now what I'm going to do is I'm going to assess, I'm going to see if I can palpate or epitrochlear nodes. So what I'm going to do for that is have her hold each arm at about a 90-degree angle, and then I'm going to palpate 3 centimeters up from the medial epicondyle in between the brachial muscle and then the triceps muscle. And I should not be able to palpate these. Okay. Okay, and those are non-palpable, so that is a normal finding. So now moving down from the upper extremities, her arms, before I have her stand or anything like that, I'm going to just assess her legs, looking, or before I go to the legs, while I'm looking at her arms too, I'd be looking to see if there are any sort of venous prominences, any tortuosities, anything like that. As we progress down to the legs, just kind of visualizing each leg once again for color, symmetry, if there's any swelling that I'm seeing, any hypopigmentation. And it doesn't appear as if there's any swelling in her lower extremities. I see she does have a tattoo on her right foot, which looks like it healed appropriately. I'm not seeing any erythema, any scarring that shouldn't be there around that. So once again, I'm going to use the backs of my hands, just going to kind of palpate down each leg, noting the temperature, any moisture. And then while I'm here, I'll assess cap refill on her toes. A little bit of a slower cap refill, but still less than 3 seconds, which is normal and expected because it is on the lower extremity. And then while she has her toes kind of in this position while I'm down here, I'm going to assess them, seeing if there's any sort of ulceration, any cuts, any things like that, lacerations that shouldn't be there. And Lindsay does shave her legs, but I would be assessing to see if there's any loss of hair in the lower portion near the malleolus, ankle, kind of lower calf area, and if there's any discoloration of skin as well, which there does not appear to be. Okay, Lindsay, so now I'm going to have you lay back onto your back, and I'm going to be palpating our arteries. So our femoral, our popliteal, our dorsalis pedis, and our posterior tibial. And then while I'm palpating the femoral pulses, then I will check for the superficial inguinal lymph nodes as well. So then I'm going to do behind the left leg. Now the right leg. Now down to our feet. And posterior tibial. Okay, and I'll say those are all approximately 2+. A nice palpable pulse in her lower extremities. And then no edema that I'm noting as well. Any pain in your lower legs ever when you're walking or exercising?
Sometimes when I'm at work, but I'm a nurse in an ER, so sometimes my legs and my feet get a little sore, but I try to elevate them after work when I get home.
Okay, and I'll definitely recommend for anything, any career of that nature, we'll advocate for compression stockings just to help with venous return. I'm not seeing any varicosities at this time, or any prominent varicosities, but it does appear as if you might have the beginnings of some spider vein, like angioma formation on your calves. So one test that we could do here to kind of assess for venous arterial sufficiency is I could have her hold her leg up at approximately a 60-degree angle until I'm noting pallor, and then I could have her put it back down and then sit up just to see how brisk color returns. And I'll have her do that with each leg bilaterally. And then another special test that I could do is the Allen test, where I test arterial sufficiency in her wrist. So I'll kind of verbalize that, and I'll have her make a fist, and then I'll occlude both the ulnar and the radial artery until I see pallor beginning to form in her hand, and then I would release one of the arteries. In this case, I'll release the ulna, and then I'll have her open her hand, and then of course I see the color change, turns from kind of like pale, pallorous color, and then we have the erythema as the blood rushes back into the hand. That is my assessment at this time. Lindsay, do you have any questions?
No, I do not.
All right, thank you for your time.